yes we can become the leading star. Putting our patients first will make MIOT lead by far.
We work as one family. We work hand in hand. We work to make our nation proud. We'll be the best in the land.
Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far.
We heal with pride and passion. We heal with faith and love. We heal with truth and harmony. As sure as God's above, with God sent to guide us, our skills grow day by day. Putting smiles on people's faces, that's the MIOT way.
Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. We can do it, yes we can. The best by far. We can do it, yes we can.
We can do
The leading star. We can do it, yes we can.
Yes, we can.
With pride. We can do it, yes we can. Leading star.
Good morning, everyone. Welcome to this edition of the Hindu Wellness Webinar series. It is being presented to you jointly by MIOT International. We have with us Dr. Shankar Balakrishnan, interventional neurologist from MIOT Hospital. Today's webinar is on revolution in stroke treatment. Dr. Shankar Balakrishnan spearheads the Movement Disorder Clinic at MIOT International. He is specialized in treating vascular disorders, stroke, aneurysm, AVM, etc. of the brain and has successfully performed more than 500 surgeries. Dr. Shankar is also one of the leading DBS, deep brain stimulation specialists in India, and with nearly 30 successful deep brain stimulation surgeries to his account. He's an active member of neurological academies nationally and internationally, and has authored and presented research papers in various national and international forums, and has co-authored research articles published in international journals. Dr. Shankar has a fellowship in intervention neurology from the University of Zurich, Switzerland, and a DM in neurology from the Institute of Neurology, Madras Medical College. He was awarded the prestigious Professor COV Gold Medal for All-Rounder Best Outgoing Student of the Year in DM Neurology in 2015. Welcome, Dr. Shankar.
Thanks for a nice introduction, ma'am. Yeah,
Thank you, sir.
thank you.
So I would like you to tell us what exactly stroke is and how a person can identify if there is a stroke.
Okay. So we'll go through a short presentations which will
Right.
explain what is stroke, how to identify stroke, and what people should do if someone in the family or their loved ones do have stroke. So October is considered as the month for stroke, and October 29th is celebrated as Stroke Awareness Day or World Stroke Day. So I think these presentations will help many.
Okay, sir.
So I choose the topic revolution in stroke. So many know what is a stroke, but most of them need to know like how to identify a stroke and what to do next. Suppose the awareness about a heart attack or the MI in heart, there's immediate attention is there in the family. Somebody develops chest pain, they immediately rush to a hospital and seek medical attention. But with stroke, the presentations may vary, so they take time. And actually, what is strokes is if there is a cutoff of blood supply to the brain, then the brain cells they lack oxygen and nutrition and they die. So resulting in paralysis. Strokes are of two types. One is the hemorrhagic stroke, another is, and we call it as infarct. Means if there is a block, there won't be supply to the brain. Also, if the blood vessel ruptures and the blood leaks into the brain, then also the brain cells cannot survive. So both of the things are a medical emergency and they have to reach to the hospital. So everyone thinks like stroke is a very rare disease, but it's not at all. So it affects 1 in 6 people. And in India, like every day, 4,500 people are suffering with a stroke. But when we look out the awareness, it's very, very less. So what they should do is and even it is this 4,500, hardly even 1% of the patients reaches the right place at the right time. So stroke is a major public health problem throughout the world and resulting in death and disability. So when we look out the causes for death and disability, stroke constitutes on the top, resulting in complete paralysis and make them dependent. And I believe that stroke is a disease of the elderly, but it is not so. Stroke can affect anyone. Though it is common among elderly, nowadays, with a recent, like with it is a non-communicable disease, with the lifestyle modifications and with the evolving sedentary lifestyles, the strokes do occur in young people also. And we have seen a lot of patients with stroke during the COVID times here. Those who are like aged between 30s and 40s, they were presented with strokes. And what is the truth is 80% of the strokes are preventable through their lifestyle modification, like eating healthy foods, keeping their blood pressure under control, and then meeting the regular physicians to manage the blood sugars, keeping the cholesterol level low in the blood. And alcohol do harm, like the atherosclerosis will happen faster if they consume alcohol. Smoking is a very bad thing, and doing exercise really helps them. And if they do have any heart disease, they should seek medical attention immediately. And everyone in the nation should know what are the warning symptoms of stroke. The warning symptoms of strokes can be remembered as fast. The word letter F stands for the facial drooping, A stands for arm weakness, and S stands for slurred speech or difficulty in speaking. So when they notice something, when these three symptoms do occurs with a family member, immediately they should call for an ambulance. And sometimes stroke can present with some other symptoms also, like loss of balance and sometimes loss of vision or a blurred vision sometimes tingling sensation or numbness on one half of the body. So identifying the stroke early is very, very, very essential to prevent disability and a death. So they coined the word time is brain, because what happens is whenever there is a cutoff of blood supply to the brain, like every minute, almost like 19 lakh of brain cells will die. And when this time evolves, the cells will die and resulting in permanent damage to the arm and the speech and balance problems. So they should reach a comprehensive stroke center. That is very important. Currently, what are the scenarios is going on is they don't know where to reach. They go to the family physicians and then they refer to them. In this thing, the time is wasted. They should go to a place where imaging facility is there and an interventional therapy assistant and a neurologist is there, because we have to remove the block and reperfuse the brain. We have to restore the blood flow to the brain, which is very essential. So when a patient reaches a hospital, initially the neurologist will see them and then they immediately ask for a brain scan. This is the most important step in stroke management. The brain scan will tell about the type of stroke, whether it is a bleed or it is a block. If there is a block, then removing the clot is the very essential for a complete recovery. So if they present with a golden time, we call it as 4.5 hours from the symptom onset, a simple medicine called clot buster can be administered through the peripheral vein, and this clot buster will dissolve tiny clots. Through the time, we understood that the tiny clots can be dissolved with the help of a clot buster, but sometimes the larger clots cannot dissolve with the IV thrombolysis medications. For those patients, and also patients who present beyond 4.5 hours and less than 24 hours, they need a special procedure called mechanical thrombectomy. So what is mechanical thrombectomy is when the clot size is bigger than say 6 mm to 10 mm, sometimes they don't dissolve with a clot buster. So we need to take a small catheter, it is like a small plastic tubes which can reach the blood vessels and from the peripheral port. And these catheters will cross and then they slowly absorb the clots mechanically with the help of a pump. Sometimes a stent material will also be deployed across if there is a reocclusion, means once we open up again, if it closes, then we may need to deploy a stent also. Once the clot is removed, the blood flow is restored and the cells will survive. So this is what the management of strokes so far. And what is the revolution that is happening in the stroke? That is going to be the talk of today. So we understood that acute stroke, time matters. So as time passes, the number of cells in the brain gradually dies, and one neuron dies, they will never come back. So act fast is the revolutionary word, and time is brain. We need to act really fast. So what is happening now in the world or in any countries is they go to a primary center, and from there they refer to a comprehensive center, and from the comprehensive center they refer to a center where intervention is possible. So cutting out all these timings in spending time with CT scans and MRI scans, and then shifting from one place to other will be cut short with the help of a new way called direct to the angio suite. So here the patient, once analyzed in the emergency, they will directly move to the angio suite where we perform a multiplanar CT scans. So the CT scan will tell us whether there is a bleeding or a block. So what is more important is every decision is based upon what we really see there. So the scans can do like within 5.2 seconds, they will do an immediate fast scan, and which will help us in understanding whether there is a bleeding or a block. If there is no bleeding, we can directly lyse the clot with a clot busters, and immediately we'll do an angiogram to study whether the blocked blood vessel is opened or not. Advanced softwares or also help us in navigating the catheters even through distal vessels. Sometimes we may need to deploy a stent also to prevent reocclusions. And this softwares also help us in carrying out the procedure in a very safe way. This CT is a comparison between the conventional and the CT done in the angio suite. So when we deploy a stent across the vessel, we need to check whether the stent is approximated, means the stent is well placed across the stenotic segment. There are advanced softwares with this machine to help us understand how well the stent is approximated and prevents the occlusion. When it comes to the bleeding, aneurysm and AVM are the commonest cause. So with these settings, the aneurysm bleeds and then patient presents with a severe headache and paralysis sometimes. So re-bleed is a cause for sudden death in aneurysm patients. So we need to secure the aneurysm. Aneurysm is just a bulge in the blood vessels. So we can clearly see and we can deploy a stent or we put some coils and we completely restore the reflow of blood into the aneurysm, preventing it from rupturing again. Again, when we see AVM, there's a tough vessels. Though it is a rare disease, they do occur. So here we see abnormal vessels, where abnormal tiny vessels where the artery and the vein directly communicates, resulting in the veins cannot tolerate the blood flow that is gushing in and then they bleed. So we need to disconnect the communication. The previous machines that we were using to follow this techniques, it's very difficult to delineate or subtract the bone completely. On your right, you can see the dental enamels and the bones shadows, but with the new machines, these artifacts are subtracted and we get a clear view of what we are dealing with. It. Rehabilitation, stroke management doesn't end without a rehabilitation. Most of our patients do require speech rehabilitation, swallowing rehabilitation, physical movements, and daily activities. All these will put back a stroke patient back to their normal life. So saving life is very important, and putting a patient like without disability to the society and family is very important. So when we notice a facial drooping, an arm weakness, and a speech difficulty, it indicates it's time to call an ambulance. And stroke management is a teamwork. It is never handled by a single person. So stroke does not have to mean death or disability. Once you notice a signs of stroke with your loved ones, just call for an ambulance and the stroke treatment starts from the ambulance. Our team immediately alerts the entire persons in the hospital that we are picking up a stroke patients and we will be ready to receive them and directly shift them to the angel suites, do a scan and use a clot buster to dissolve the clots. If it is tiny, it will get dissolved. And if it is not dissolved with a clot buster, immediately we do a mechanical thrombectomy and we save the patients. So what is more important is know the signs of stroke, get help, act fast. Thank you.
Thank you. Thank you, Doctor. That
Thank you.
was pretty short, but very interesting. And we already have some questions, but I have to ask you the first question that's in my mind. What should you do to prevent stroke or at least reduce? I know you said control your BP, but there is something called vascular stroke that occurs in people who have diabetes. How do you control that and how do you prevent that?
Yes, stroke, we classify them into young stroke and then stroke occurring with elderly. So both of them, the causes are different. So diabetes do occur in middle and elderly people. So what diabetes actually does is they make the platelets very sticky. So keeping the diabetes is very, very essential. The platelets is one cell in our blood, which make them very sticky. And if a diabetes goes uncontrolled, it becomes too sticky and they will club together to form the clots. And the platelet clots are very difficult. Most of the time, the platelet clots won't dissolve with your clot buster. If it is formed by the RBCs, they will dissolve faster, but the platelets, what happens in very poorly controlled diabetics is a sticky platelets clubbing together. And also like diabetes and hypertensions are two bad combinations that will increase the deposition of cholesterol in a faster way, resulting in complete blockage of the blood vessels. So that is very important to prevent the cholesterol deposition in the blood vessels. So if you keep your diabetes control and your hypertension under control, you're delaying the process called atherosclerosis, means deposition of cholesterol in the blood vessels. So that's how you can prevent stroke. Though like every factor, diabetes, hypertension, everything is an individual risk factor for the stroke.
Okay, you said about diabetes, how the platelets stick together.
Yeah.
What happens in a person with high BP?
Yeah, the high blood pressure, what actually does to the blood vessels is it creates a shear force and makes a material called hyaline, which deposits in the blood vessels. So with the hyaline deposition, an elastic blood vessels cannot stretch more. So it becomes very fragile. So a long-standing hypertension will cause the blood vessels to be very fragile. Sometimes if there is a shoot up of blood pressure, they give away, they burst, and then resulting in leakage of blood into the brain. So that we call as hypertensive bleed and a stroke. So it is not just controlling blood pressure. It just they have to maintain a constant normal level of blood pressure, regular follow-ups, regular monitoring is necessary. It is not just if they miss the tablet today, tomorrow they will develop stroke. There is a long, slow process that is developing in the blood vessels. So we need to focus on that. So that's how some patients they stick to one tablet and then they continue the same tablet throughout their life. So that results in loss of elasticity of the blood vessels.
Okay, so there are two things that are happening. When you have diabetes, what happens is the platelets stick together, whereas when you have hypertension, the elasticity of the blood vessels is lost, which is resulting in bleeding.
Yeah.
So is it right to say in diabetes it's actually blood clot development, and in hypertension it is actually bleeding in the brain? These are two different things happening.
The hypertension not only makes the blood vessels fragile, it also enhances the cholesterol depositions, and then the shear force, the high force will rupture a block, it will tear the block, will tear the protective layer inside the blood vessels and exposing the beneath layers of the blood vessels. And these sticky platelets, once they see the surface, the inner surface, they go and stuck together. So hypertension can cause bleeding, and hypertension can also cause a block also. So it is potential to cause both the phenomena.
Okay, thank you so much. That was really interesting and good explanation. I mean, like, at least I know what exactly is happening inside the brain. Then the question here is, it is now that we are talking about, when exactly would you say that a person has had stroke? You did talk about fast, but not all of us would be checking on our own people every time to look for something that's going wrong in a person. But is there a way that I can actually prevent stroke from, you did say controlling blood pressure and BP and diabetes would help. But is there something else, something more that a person can do before this fast comes up?
Yes, ma'am. Like prevention can be classified in three ways for all the disease: primary prevention, secondary, and tertiary. Primary is something like before the disease do occur in our body, we are trying to prevent it. Like how in COVID, like we take vaccines and then we protect ourselves before the disease, we are trying to prevent it. So the same way for non-communicable disease also, there is a way to prevent the disease before getting the disease into the body. So that the primary factors, we have to control the risk factors. If we control the risk factors, we're not going to get the disease. And in controlling the risk factors, if they are an elderly, keeping the diabetes, hypertension, something, and what is more important is undergoing screening tests. Suppose if the family do have a strong history of stroke, and if the person do have a lot of stress, and if he couldn't do his physical activities, or his lifestyle is not so smooth, and he's busy with work, and then he's stressed too much, all these factors will increase. For them, primary prevention, what they have to do is a simple screening test. So when we do the screening test, we will know how much he's more prone to get a stroke. A simple and like a carotid Doppler or a simple scans to identify what is the status of the blood vessels in the brain before they develop the stroke. Putting them on medical management and correcting the risk factors will definitely prevent the stroke.
Thank you. Thank you so much. So here is a question from an anonymous attendee. A person having a past history of LAD stent and after a year having ventricular tachycardia. He is placed in an IOD device. Is that correct? IOD device now. How can a person prevent further from getting, he's saying, I don't know, infection? I don't know. Maybe he's talking about COVID infection. I don't understand.
No, or he had some heart disease. Some LAD is one of the blood vessels to the heart. They put, and there was a block in the vessel. They put a stent, and his rhythm, the rhythm of the heart is very important. If the rhythm is good, then the blood keeps flowing. If the rhythm is not good, then the blood will stay. Wherever blood stays, then clot formation occurs, and the clot can go anywhere, especially to the brain and resulting in stroke. So they put a device to make the rhythm. That's what he's mentioned as it's a pace kind of pacemaker.
Okay.
It's installed for him. So when they do have these pacemakers, the rhythm of the heart is maintained. So it can, though the heart doesn't beats in a rhythm, the pacemaker will help in making the heart in a rhythmic way. So the blood flow never gets stagnant. So there won't be any clot formation. And they have to be in follow with a cardiologist also. Any foreign implants into our body, we need to be very cautious. We need to be in touch with a person to monitor how it functions, whether it is really functioning, is there any infections happening inside the implant. All those follow-ups the cardiologist will do.
Oh, okay. So infections can happen even inside the pacemaker.
Any foreign body, they don't have a blood vessels to protect it, and like every organ do have a blood vessels, and our first line defenders will present. When you put a foreign material inside the body, they don't have a blood supply for it, so there is a chance. And when they put an implant, they should choose a center like an implant center where they take all precautions to prevent an infection. So it should not be like a place like everything is happening. They should go for an implant center where special precautions are there to prevent infection.
Oh, okay. Thank you, sir. Thank you so much. So here is one more person. This is a personal, I think she has had a stroke. She had an ischemic, she got acute ischemic stroke.
Yes.
This happened last October. It happened in October 2019.
Yeah.
And she also had mild paralysis on right arm. So thrombolysis was done immediately.
Yes.
So she recovered within a week, and she recovered with paralysis in the right arm. But once a year, there is very much spasticity, cramp and stiffness in the same arm from neck to fingers. Okay. So she says, how can I become normal? How she's wondering if she can become normal.
Yeah, definitely. So she developed a stroke and they used a clot buster. But as I said, time is very important. So the percentage of the cells that we save depends on the time. So clot busters, even though it opens the blood vessels, the cells which died or like they don't come back. So that can result in residual paralysis. And one good important thing with the clot buster is, though there may not be an immediate magical improvement in all patients, but when they do rehab at the end of 3 months, it's 90 days after the stroke is the best time that they will recover from the stroke with help of rehabilitation. And sometimes a residual stiffness can be there. So the paralyzed limbs will get stiffened. That's called the spasticity. So rehabilitation actually takes away the spasticity. Sometimes with simple physical therapy, and sometimes they may need some specific injections like botulinum toxin. So botulinum toxin, actually it is a paralytic agent. So it's a toxin from botulinum. It's like our tetanus. It's a toxin. When injected into the muscle, it will make the muscle relax. But they should continue the physiotherapy also along with the Botox. That's how they overcome spasticity.
Okay. Thank you, sir. Thank you very much. So you have been talking about symptoms of stroke. What is the symptom that I should look for? As a bystander, what should I do when somebody is actually suffering a stroke? How would I know they are even suffering a stroke?
Okay. So like when we talk about stroke, it presents in different forms. That's why the uniform mnemonic of be fast was promoted. So, and what is fast is the facial drooping will be there. So whenever they try to drink water, it will drool from one side of the mouth. And when you make them ask them to smile, that one half of the face will not move and the other half will be deviating to one side. So that becomes prominent. And also like when the arm stiffness, when you ask them to lift the hand will drop suddenly. So this is called the arm drift or arm weakness. And S stands for a slur speech. Like when you talk with them, you feel that the speech is slurred. So it will not be clear. You may ask to repeat and repeat again and again. Some may present with some sort of dizziness and imbalance. They couldn't walk. They sway here and there when they try to walk. And um, and sometimes eye symptoms. They complain dizziness and double visions, sometimes blurred visions or loss of visions. So these are the common symptoms of a stroke. And sensory stroke, there won't be any weakness, but they feel that the one half of the body, a face or sometimes a limb, will get some sort of numbness or tingling, which was not there and ever before. It starts acutely. That's how the sensory strokes will present. So what is a word stroke like? What's most important is it starts in 5 to 10 minutes. Like before 10 minutes, the patient will be absolutely normal. And within 5 to 10 minutes, you will see all the symptoms. So that is what is acute stroke. Something acute, the word acute is states it's something sudden and surprising. So before an hour, the patient will be absolutely normal. And just when you notice them, they all develop these symptoms. Initially, it may be mild, but it will gradually evolve. So that is how we identify the strokes. So previously, normal person suddenly developing these fast five symptoms, we should suspect a stroke. Whether it may be a stroke, it may not be a stroke, and most of the time it would be a false alarm. But even then, bringing them to the hospital in time is very, very important.
You said that stroke is generally, and earlier at least, it used to be something for the elderly people, and now more and more youngsters are getting it. So when this is pretty scary when you say youngsters are getting it, and it may be a false alarm. So how do I know what is a false alarm? It's just that I keep my BP and sugar under control. Should that be enough?
Okay. So in people, I mean to say, there is an increasing in trend that the early onset of diabetes, early onset of hypertensions are there. That is one set of population. Other set of population will have an inherited property of the blood going into a clotting stage due to certain vitamin deficiencies or mineral deficiencies, or sometimes there will be inflammation of the blood vessels. We call it as vasculitis. So, or they are also prone for the strokes. So when we talk about the recent change in trend in young strokes is mostly because of their lifestyles.
So how young are the patients? I mean, like how young has it become now? Let us
We
say,
have
is it
started
30,
seeing
40?
initially like the trend is like 60s, 70s. Now it has becomes 40s, 50s. So anybody above the age of 35, now they need to be on track with their health records.
Okay, a person who is 35 should be
Yeah,
maintaining.
at least once in a year they should just check their blood pressure, sugars, and thing. And what is more important is I won't recommend them to come to the hospital. I recommend them to keep moving, like whatever busy lifestyles, just an early morning walking of 45 minutes to 1 hour. If they do it regularly, that is what I recommend. I don't recommend them to come to hospital. Change their lifestyle, however busy, however stressful, just an early morning walk.
Oh,
At
that's a
least
beautiful thing.
yeah,
One
such a
hour
4 to
walk a
5 days.
day is
1 hour
something.
walk a day, 4 to 5 days a week is more than sufficient, and spend some time with the family and sleep.
Okay.
Yeah, these two things, whether it is 30s or 40s, just they should begin with this thing.
Thank you. That is really nice. And so we were talking about when I have you were also saying that if you have stroke, don't go to your GP or don't go to just any hospital, but make sure you go to a hospital which has all the facilities. So
Yes.
how many facilities should I be looking for when I choose a hospital?
Yes, when we do have a strokes, how the time is currently wasted is anybody who is falling sick, the first trusted person is the family physician.
Yeah.
So when they go to the family physician, like we have a tendency to go to the clinic and wait for the doctors to call them. There may be an emergency, we will wait there. Sometimes symptoms may be mild. So they waste the time in waiting to meet the doctors. And once the family physicians identify it, and then he refers to the thing, They had to need to, the clinics won't have an ambulance there. They need to call an ambulance and wait for the ambulance, and then they come and go to a center where there should be a neurologist, there should be an intervention neurologist, there should be a cath lab, an advanced, like now the health is like previously it was like clinical management, clinical assessment. The clinical assessment cannot be like replaced, but the technology is making the clinical assessments better, making the clinical management better with the help of technologies. So at no point in time, technology cannot replace the conventional method, but to make the life better. So to go to the hospital where there is a cath lab, that is what the revolution that is happening. Sometimes initially they believe that the clot buster can lyse any clots, but scientifically now we are understanding that even after the clot busters, the bigger clots, they don't dissolve. The clots which are rich in platelets, they don't dissolve. Sometimes they do need mechanical thrombectomy. And sometimes even if we miss the golden hour of 4.5 hours, mechanically opening it can save, can make them better, can prevent paralysis. So they should choose a center where an cath lab or an interventional neurologist and a team is there to help them. And even after removing the clot, the rehabilitation starts in the ICU. It is not like we open the blood vessel, we put them in ICU. The rehabilitation also starts from the point of the stroke, and the point of identification of the stroke. So that is how the cells, the dead cells will not function. So the surrounding cells has to take up the loss function. So the rehabilitation plays a vital role in getting things. So how they should decide is there should be a team, there should be a facility to do at least an angiogram and mechanical thrombectomy. Going to other places, just what we understood all these years is it's like we are wasting time. So they should act fast.
Thank you. And you've spoken about a patient who has lost probably the golden period of 3 to 4.5 hours, and he comes within a day of having suffered the stroke. Now, if such a person, or even for that matter, anybody who has had stroke, can they get back after rehabilitation? Can they become their normal self? Is it like, listen, I've had stroke, but I'm perfectly normal. I can lead a normal life. Is that possible?
Yes, that is possible, very much possible. So even if they miss the golden hours of 4.5 hours, up to 24 hours, if our scan shows live tissues, the cell may not function, but they will be live. How, like if we forgot to water our plant for a day, they will be dry. But next day when you pour water, they again come back to the life. The same like brain cells, if there is no blood supply, they will stop functioning, but they will be still alive up to 24 hours. There are ways to identify it. If we find uh, a live tissue, then mechanical thrombectomy plays a vital role. So how our machines, how in MIOT works is we do protocols standardized to cut short other time wasted here and there. We direct them to the advanced biplane machine where we do good quality CT scan, just like the other CT machines can do. A biplane can do a CT as much as clear, and we can identify, we can rule out the bleed on the spot, and we lyse. Also, we do an angio to check whether the clot is lysed or not. We confirm it. So the machine helps in confirming that the treatment is 100% successful. It's not, sometimes the clot can partially lyse and partially cannot lyse. So the machine actually helps in completing the treatment. So and the rehabilitation also starts there. Suppose if patient comes after 24 hours, still orders is the rehabilitation has in control. The first 90 days after the stroke is a very vital time, very crucial time in rehabilitation. We follow intense rehabilitation protocol. It's like 6 hours a day for 6 days a week for 6 weeks. It's called the intense rehabilitation protocol. So that will help in faster recovery. And also the recovery depends upon two things. One is the age of the person. So as age advances, our learning capacity of the brain, we call it as plasticity of the brain, gets down. So and a person who is in 30s or 40s, when we rehab, they do a good recovery. But in like 70s and 80s, they do have partial recovery. But with the help of intense rehabilitations, we can make them definitely much better when compared to persons who don't have a rehabilitation.
Thank you. Thank you so much, sir. So we've been talking about the treatment options for what are the treatment options for ischemic stroke after 4.5 hours of stroke is we've already spoken about that, but can you explain it a little more?
Yes, yes. So what is thing? Well, time is brain was a concept so far. So they think that when as the time progress, the cells that do occur. But if the youth is a clot buster after 4.5 hours, there is a chance that there can be a bleeding also inside the brain. So we were very hesitant to use after 4.5 hours. But the truth is, still cells survive. They're still asking, like, is there a way for me to survive? That's what, and this is done with mechanical thrombectomy, where there's no risk of inducing a bleed. It is just passing a safe catheters through a good roadmap that we take. It will take us. It will easily take us to the place where the clot is sitting. We can visualize. The machine magnifies. It's like fourfold, fivefold times it magnifies, and then accurately we can locate and we can catch the clot or we can aspirate the clot. So that treatment option is called like beyond 4.5 hours up to 24 hours. It's now proven worldwide that there is even chance by if they have if they evolve, if they reach after 4.5 hours, we may not be able to use the clot buster, but safely we can mechanically remove the clot with our biplane machine.
Thank you. Can you explain a little more about this biplane cath lab?
Yeah, actually, what's the difference is like there are cath lab is there for many years, and what is special about the biplane machine is we can see both the angles in a single shot. There will be two arms. There will be two C arms. One is to look from the front and the back. The other arm can capture from the sides. So it cuts short the time. Usually, stroke treatment mechanical may take 2 hours, but with the help of machine, we can do it in 30 minutes. So that makes the process faster. It reduces the amount of contrast that we inject into the body. It reduces the radiation also. It makes the time faster. When we talk about stroke, we talk about time. So this biplane machine cuts short the time and then making the process easy to take out the block in a faster, safe, and accurate way. And there are a lot of softwares also comes with the machine, and these softwares helps in deciding the treatment and to carry out the treatment, and also helps us in confirming that 100% that we have removed the clot and brain of blood flow is restored.
Thank you, sir. Here's a question from somebody. One of my friend, apparently they had a stroke after taking Covaxin.
Yeah.
He wants to know whether it is due to Covaxin or could it have been some other reason.
Okay. So COVID, when we acquire COVID, the COVID virus, initially we were very difficult to understand the behavior of the COVID. But the COVID do affect the blood cells, like the blood vessels, making it more prone. And also it thickens the blood to form clots. So that's how initial days we started seeing patients with the COVID developing stroke. So the COVID virus do have a capacity to form, to make the blood thick and to get a stroke. When we take Covaxins or Covishield, we're getting protected against COVID. And so far, there is no recommendations that we have to halt because there is a risk of occurring a stroke or occurring an MI. So the vaccines are safe and we have to go for it, because if we don't have the virus, if it attacks, it's definitely going to cause some trouble for us. Those who are vaccinated may occur an infection, but it will be of milder variety. So they have to look at the other factors or also. So all worldwide, all the trials and studies they have done so far, no contraindications for vaccines due to fear of occurring a stroke or occurring an MI. Everyone should have it.
Okay. Thank you, sir. Thank you so much. Yes, so many times everybody has been saying that vaccine has, there are no side effects to vaccine and they don't cause any of the other problems that people are always talking about. So here is one question. Is there a relation between stroke and heart attack?
Yes, atherosclerosis means cholesterol deposition in the blood vessels. They do occur in the heart. They do happen in the eyes. They do happen in the brain. So eye is an index for like cholesterol depositions. Like initially, before, because the blood vessels of the eyes are very tiny, and the cholesterol depositions, when it affects, ophthalmologists, they used to do a screening for, right? So whenever you are diagnosed with a hypertension, you are recommended to go for an ophthalmologist to look into the eyes to check what is the status of the blood vessels in the eye. It is a marker. Suppose if the cholesterol deposition is more in the eye, it indirectly indicates that the heart and the brain is also at risk for getting cholesterol blocks. So it's a universal phenomenon that starts from the day one of the birth and it continues. Some of our lifestyle will accelerate it. If we don't do exercise, the process of cholesterol deposition will occur faster. If you consume alcohol, if you smoke, if you are stressed, if you don't sleep, the aging process will be accelerated.
Right. Thank you so much, sir. So you were talking about revolution in stroke management.
Yes.
So would you explain a little more?
Yes, definitely, ma'am. Like when the process of initially we thought the clotbusters can lyse, then they came up with mechanical thrombectomy, and the process was like to do assessment, then do a CT scan, then do lysis with the clotbusters, wait for the patients to resolve, and then if don't resolve, then shift them to the cath lab, do an angio, and try to take out the clots. So all this process in every study conducted throughout the world, the average mean time to take out the clot mechanically came around to 2 hours, like the most is to 73 minutes to 2 hours in all the standardized studies. There were multiple randomized studies throughout the world, but average time to open the blood vessel was 75 minutes to 120. But what is the revolution in stroke is, with the help of direct to the angio suite method, the time shortened that we can do it in 30 minutes from the door to the opening of the vessels. As soon as the patient reaches the door, that we call it as door to recanalization time, can be bought under less than 30 minutes. So that is the revolution in stroke. So when we always talk about time, but we spend time in waiting for the scans, or waiting in a scan centers, or doing a scan and then going to another place to take the treatment. All those things can be cut shortened by this revolutionary method called direct to the angio suite.
Thank you, sir. And here is, I want to know if people have had paralysis after a stroke. You have spoken about it, but then can they recover from paralysis? Complete recovery.
Complete recovery is what is need to know as brain cells functions. One cell dies, they never come back, but the surrounding cells will definitely take up the functions. So it depends upon the extent of injury happened to the brain. Suppose if there is more than 2/3 of a territory is gone, the other side of the brain will try to compensate it, but it depends upon how intense they undergo a physiotherapy, and also like the age and their previous lifestyle. Like alcohol intake tends to reduce the brain's learning capacity. Like the plasticity of the brain will be affected by alcohol, will be reduced with the age. So there are multiple factors in determining. And when we rehabilitate, we most of them will think physiotherapy is just sufficient, but it is not physiotherapy. There is an occupational therapies is involved, and a speech language pathologist is involved, and a physiotherapy is involved, a social worker, a psychologist. So all these put together only forms the rehabilitation. And stroke doesn't affect only the limb, it affects the swallowing, it affects the speech. And when they have a difficulty in swallowing, they can aspirate the fluid, which can get into the lung, which land up in pneumonia. Getting admitted in ICU and spending lakhs on pneumonia is not necessary if they spend few bucks for the rehabilitation and getting back safe swallow and the way to communicate. So some people, like, we need to communicate. It's not like only when we speak or when we only talk in communication. Communication is something broader than the word speech. So the rehabilitation specialist will put everyone to be in relation, to be better with their communications.
What do you mean by safe swallow?
Like, yeah, stroke patients, when it affects, the swallowing gets affected. It's not only the slur speech. When they drink, the fluid can enter into the windpipe, so instead of the foot pipe. So they don't have this protective mechanism. When we drink liquids, when we swallow solids, our windpipe will be completely closed, and then the food and water enters the food pipe. In stroke patients, this protective mechanism is lost. So whenever they drink water or solids, they tend to enter the windpipe and get settled down in the lungs, causing serious life-threatening complications like pneumonia and respiratory failure and ICU admissions. So safe swallow is one thing practiced by speech language pathologists. They identify the severity of getting aspiration. They classify them and they put them on rehabilitation methods and advanced therapies to prevent them from getting aspiration pneumonia and aspiration. So when we swallow, that should be safe. The word safe indicates the food should enter the food pipe and the air should enter the windpipe.
So I have a question here. Are you saying that people, when they people with stroke, they actually accidentally allow water or food to go into the windpipe, or is it how was it? I thought it was an involuntary movement of the.
Yes, Joe swallowing looks the simple for us. It is a coordination of around 53 muscles in and around our the lower jaw and the neck. So all the 53 muscles should coordinate and do. Then only the swallowing will happen in a safe way. Suppose if there is no coordination, then like the gate should close for them to prevent entry into the airway. They automatically will close. But this because of due to lack of coordination, the gateway will not close and they tend to aspirate or fluid into it. Accidental thing happening once in a while is something like when we do it in a wrong way, the a drop of water may get in. But in stroke patients, the coordination is lost. The mechanism is disturbed. So we have to rehabilitate it. There are multiple ways to put them back to a safe swallow methods.
Okay, thank you, sir. So here is a question. Is there a connection between stroke and cortisol count, adrenal gland swelling?
Okay, so though we call it as the stroke, we call it as toast. Means sometimes the strokes happen due to diabetes, hypertension, and poor lifestyle changes. This is one category. The other category, the cause is different. The cause is different. Sometimes the rhythm of the heart can generate a clot. So our body needs hormones to pay a balance between clotting and a bleeding. Suppose if we get a cut injury, so the bleed leaks and automatically it will stop. So our body has a mechanism to clot the blood, and also it has a mechanism to dissolve the clot also. Suppose our hormones do have a role in maintaining, called as the blood should remain liquid when it is inside the blood vessel, and when it comes outside, it should clot. The hormones do have a control over it. So whenever the cortisol levels, which is also important in determining the platelet functions and the coagulation factors, productions, everything, they do have a role and then have a connectivity.
Okay, sir. Here is one question again from the same person. Is dysesthesia, does it occur after stroke or vice versa or before stroke?
I didn't get it. It is dysesthesia or
dysesthesia.
okay.
That's what she has said. I don't know what that is. But anyway, so there's another question here. How to identify lacunar stroke?
Okay, lacunar stroke, it indicates a very tiny stroke, means less than 5 mm strokes, which can happen in any part of the body. But if it occurs in a vital region, then you will have weakness and slur speech and things. But if it is like when the nerve fibers condense at one place, like however wires or the signals converge at one place, if the small strokes happens at the convergence points, then the deficit weakness will manifest. If it is happening at a divergent point, then you may not identify with the symptoms, but when you go for a scan, the scan may show like a small scar in that region. So sometimes they do present with clinical symptoms, sometimes they do not present with clinical symptoms. We identify with the help of the scans.
Okay, so is stroke hereditary? Can a family physician diagnose it better? Can they diagnose these strokes better? And or do you suggest executive health packages, which
Okay.
many hospitals offer?
So hereditary strokes, yes, do occur. Means every function. So if it is a communicable disease or with respect to all non-communicable disease, there is a role of our genes in all non-communicable diseases. Whatever we do, it's inherited to the others also. So like diabetes, they're all complex, but influenced by the environment. Do have a genetic role, but influenced by the environment. Likewise, strokes can occur in hereditary. But what is more important is if it is 30% gene linked, then 70% is lifestyle modifications. So even though it's hereditary, it can be preventable with simple lifestyle measures. There is like what we promote in stroke awareness campaign is not to come to the hospital, but to maintain a healthy lifestyle. Then there is no need for any packages. If you don't do your lifestyle management, then you'll land up in packages and hospitals and treatments. The main awareness is maintain your healthy style, then you don't need any packages as such. Sometimes in this current situations, it's easy to tell that sleep 10 hours, go for a walk 5 hours. But when we try to cope up and do the things, that is what the stroke awareness prevention is. We talk to prevent a disease. This like awareness is to prevent the disease. It's not to tell that, yeah, you do this package, then you will not get stroke. It doesn't work that way.
Thank you, sir. Thank you. That was so nice. That was really good. And so here is one person who is saying, I am suffering from severe migraine.
Mhm.
Now it has spread from forehead to shoulders, and now I have weak muscle on shoulders. Even after, I don't know, I took
Mhm.
both still. I don't know what she means. I'm still getting severe headache. Will it go to stroke? She wants to know. So
Okay.
migraine essentially can
Mhm.
lead to stroke.
Yeah. So migraine as such is a different pathophysiology. So it's predominantly about the brain depolarization. Initially, they thought it is a vascular, meaning gush of blood flow, release of pain-producing substance for the previous thought. But it is about the transmission of waves on the surface of the nerve ending. It got some hereditary role, and migraine, once it becomes severe, like more than 3 times, 4 times a day, they should
Oh,
be on prophylactic medicines. Sometimes prophylactic medicines they do like simple medicines are there. Sometimes they need to do combination of medicine. If it doesn't bring under control, they can go for Botox also. So migraine is something evolving now, and there are papers like midlife migraine can lead to late life neurological problems. But can be very well controlled with the help of sometimes medications, and then regulating the blood flow is very important. They must be able to identify trigger factors. If they don't sleep, if they are stressed out, screen time, and sunlight, certain seafoods or allergy food, avoiding the triggers, and following some modifications, lifestyle modification, relaxing techniques, walking, will help them in preventing migraine. But if they do have migraine, they don't need to be panic about stroke, but
okay.
migraine itself is strong enough to cause some neurological problem late in the future, and it is controllable. And even sometimes without medicines, like they have to be on medicines for sometimes, and with lifestyle modifications, they can keep it under control. So no need to have a fear that migraine can lead to stroke, but migraine should be addressed as it separately. Very rare conditions, like we call it as cadasal, where predominantly headache leading to stroke. But I don't want to insist on this thing. Make it simple, like treat the migraine. No need to fear about stroke.
Thank you, sir. Thank you.
Yeah.
So spondylitic, is spondylitis related to stroke?
Spondylitis is because of the demineralization of the bones. So it got nothing to do with the blood vessels or the brain vessels. Yes.
Okay. So I visited one elderly patient with STMI, and she was hospitalized for a month. After implanted pace, oh, she has had a pacemaker. She's developed weakness in both pedal edema.
Fetal edema. Okay. Yeah.
Okay.
Fetal
So
edema.
what may be the management? She wants to know what is the management methodology for this.
Okay. So STEMI is something like your heart. There's a heart block. They treated with a stents and they put a pacemaker. She's bedridden and then she has a swollen legs. So it indicates that the heart functions. The pumping capacity of the heart should improve. The cardiologist will be able to do better work. Sometimes, if they are critically ill, the nerves won't function, and then there may be weakness also. A good physiotherapy and medical management of the fluid management, the heart's pumping capacity should be matched. The cardiologist will be able to do it.
Okay. Thank you, sir. So is partial facial paralysis, is it part of stroke?
Yes, when we talk about the facial drooping, there is one condition called Bell's palsy. So most of them would confuse Bell's palsy with a stroke. What is Bell's palsy is the facial nose comes out of the ear, below the ear canal, it spans out and it supplies the eyelid and the angle of the mouth and about salivation and glands also. So whenever there is some swelling or inflammation of the nerve outside, outside the brainstem, then it results in weakness of the face. So the facial, or we call it as drooping of mouth, and inability to close the eyelids stronger. So that is
Okay.
called Bell's palsy. So if we strengthen the nerve, they will recover. But depending upon the severity of the injury to the nerve, if it is very severe, they need to be on long-term management, long-term rehabilitation.
So is aspirin prescribed? No, he says aspirin is prescribed for which type of stroke? Is it being prescribed for stroke?
Yes, to prevent a stroke, we need to
Okay.
take antiplatelets. So as I said, diabetes, the patient becomes sticky, so they tend to stick to each other. Your antiplatelets, aspirin, clopidogrel, ticagrelor, all these medicines are antiplatelets. So they prevent the platelets from sticking to each other. So taking an aspirin is a secondary prevention. So so the disease has occurred or there is more prone for it, and then to prevent it, we put them on antiplatelets. So antiplatelets can reduce the second stroke, like another stroke.
Oh, okay. Thank you, sir. So a patient of mine, she's a female, had a lacunar stroke 7 years ago with mild paralysis of the entire right side with some loss of sensation. Now she complains of increased pain in her right side with a feeling of heavy weight during her menses, during her
Okay.
periods, and doesn't seem to reduce despite mefenamic acid. I'm sorry, I don't know. Mefenamic acid. So she's around 50 years old and she's on the way to menopause. Please kindly explain if there is anything that can be done or if there is a link between menses and the areas of paralysis due to stroke.
Post-stroke pain happens. So after a stroke, a paralyzed limbs, we call it as a post-stroke pain. There's a pain in the distribution of the paralyzed limb. There's a separate entity. But so before a physical examination and a consultation is mandatory to conclude whether it is a post-stroke or some other pain which is linked. So I would recommend them to go to meet a neurologist nearby. So to get a consultation, get a physical examinations before we conclude it is a post-stroke pain or not. I suspect post-stroke pain, but definitely they have to consult some specialists.
Okay, thank you. And so is there a specific time during the day when people may be more prone to stroke, like early morning?
Yes,
or
yes. Yeah, strokes do happen during early morning. So our body has our own biological clock. So most of the blood flows regulations do have a dip in the early morning. So most strokes happens during the early hours between like 2 to 4 a.m. Most strokes happens. So that's one thing that we observe, and it has got an seasonal variations also. During autumns and winters, there will be more strokes. So do have like our biological clocks behave, have a role. Strokes do happens mostly in things, and they present with a wake up event. They go to the bed next day morning, they can't lift their limbs. That is a called wake up event.
Oh, okay. So my father suffered from stroke at the age of 80. I am
Mhm,
57 years old and I'm hypertensive.
mhm.
Can I take a screening test? And of what kind should the screening test be?
Okay, so keeping your hypertension under control is the first thing that I would recommend. And screening for prevention of strokes is carotid vertebral Doppler, transcranial Doppler, and a simple MRI screening of the blood vessel. There are three ways to do it, but again, it's not like just a test. There are multiple factors involved in it. Without consultations, don't go for any packages or things. Consult the physicians. If only necessary, a doctor will prescribe some screening test. If it is not necessary, nobody will ask for a test.
Okay, so here is one person, Dr. M. Jayakumar. Uh, so I think he's not a medical doctor. He says BVSC.
Mhm,
I'm not sure whether that is correct. Anyway,
mhm.
he says unconsciousness and fall on the floor and then recovery. Is that related to stroke?
Okay, so what he does is transiently we lose the consciousness, we hit the floor. Sometimes we call it as a syncopal attacks. They recover faster, and like in strokes, they will not recover immediately if there is a sudden loss of consciousness when they hit the floor. It could be a seizure or a syncope, or the first thing that we think about it. It could be a convulsions or fits, something, or it could be a syncopal attacks. There are like the heart stops for a second, or the rhythm gets stopped, the brain doesn't get a blood supply, they faint, and after a while the heart beats again, they regain the consciousness. So sudden loss of consciousness is what he's talking about. So when they completely recover, these two conditions stands first before a stroke.
Okay. If an individual is identified with a high risk for stroke,
Mm-hmm,
such as stenosis in the blood vessel to
mm-hmm,
the brain,
mm-hmm.
how can we prevent stroke in such a person? Can
Okay.
he be managed medically?
Yes, what we need to know about is first to classify whether the stenosis is causing symptoms or not. So if it is symptomatic, like if it is creating trouble, yes, definitely they will need an intervention for it. And like what is intervention is, we do an angiogram to study the block first. If the block is ulcerated, if the block is ugly looking, if there is a bleeding happening inside, we can do we can just study the stenosis. And if degree of stenosis also, like suppose 70% and above, those types definitely need a stenting across
Okay.
the stenosis segment. If it is a healthy looking, healing, and then compensated and asymptomatic, then medical management is sufficient.
Thank you, doctor. So here is one question. What is the connection between Parkinson's disease and stroke?
Okay. Parkinson is a degenerative disease, means the cells die earlier than actually it should. So the cells in the midbrain, the backside of the head, they die and they are not able to produce a chemical called dopamine. So because of dopamine, the body gets a slowdown, tremors happen, the balance gets disturbed, they become stiff, multiple pains, constipations. This is a degenerative disease altogether. And the line of management is completely different. And stroke is all about your diabetes, hypertension, risk factors, lifestyles, and things, and changes in the blood vessels that is happening. So connectivity between the two disease, if a Parkinson's develops a stroke, the outcomes, like we need to struggle a lot to bring them back to a normal life. We have to manage both. And as such, Parkin itself is etiology wise totally different disease, but when they get in combinations, the rehabilitation, we completely depend upon the rehabilitation team to bring them back.
Okay. Thank you, sir. And so here's one question. What will be the treatment methods in case of bleeding? I think he means bleeding in the brain.
Mhm.
So how do you treat bleeding in the brain?
Yeah, we try to find out the cause and the source. If the cause is hypertension, just manage the hypertension and look at the size of the clot. If it is just close to the surface of the brain and significant volume, like more than 30 ml, Surgeons helps in drilling and then taking out the blood clot. And sometimes if they are deep seated and tiny, they will resolve with the time. Just manage the hypertension. If the source is some like thing like aneurysm, which is a bulging from the blood vessel, or an AVM, abnormally connected tuft of blood vessels, and then we need to remove whatever abnormal through endovascular or surgical methods. So we need to find the source and the cause.
Thank you, doctor. So here is how much does an alcoholic and a drug users are prone to stroke than the diabetics and okay. So what he means is how much more is the chances of an alcoholic or a drug user getting a stroke as compared to a person with diabetes and hypertension.
Okay, so hypertension, diabetes, everything is an independent risk factors. Everything is an independent risk factors. When we talk about independent risk factor means like if a person has alone hypertension, that itself is an risk factors. When they try in combinations, then the risk is the threefold, fourfold it goes. So alcohol also accelerates atherosclerosis. Drug abuse also accelerates atherosclerosis. They make them prone. So both like when we weigh or when we list, it is like it's not like this is threefold risk, this is fourfold risk. Every unit has an independent risk factors. Every has its own mechanism to cause a stroke.
Thank you, sir. So here is a person, here's I think it's a personal question from a woman about her husband who is 51 years old. He was diagnosed with SAH last year.
Subarachnoid hemorrhage.
Okay.
Yeah.
During treatment with coiling, unexpected clot was detected and treatment for which resulted in excessive bleeding. He is a heart patient who has multiple stents from last 15 years. We are still struggling to rehabilitate him. He's in the rehabilitation center. He is still bedridden. Okay. What other treatments are possible for such a person, she's asking.
Okay, so it depends upon the amount of brain tissue that we lost due to anything, due to any cause, whether it's because of the bleed or because of the block. And the amount of brain tissue that is lost has a role in the recovery. Suppose if more than 2/3 territory is completely gone, and when like we call it as the MRS at 90 days, means how much they are independent at the end of 3 months after a stroke event determines. So aggressive management, aggressive physiotherapies we do like to bring them back. And beyond 90 days of rehabilitation, the process gets very slow down, but they need to continue with the physiotherapies and other methods. Still now, like any other organ, there is no replacement for the brain. So,
okay.
So that's what. And soon robotic involvement and stimulations, direct stimulation of brain will bring a revolution in the rehabilitation.
Thank you, doctor. There are a lot of personal questions here from patients about their family and their friends. I think we should forward it to you so that you can answer them.
Sure, definitely.
In person.
Definitely.
Some of them have given their phone numbers, so maybe they could. I think the team would send it.
Yeah, our team will definitely will get back to them with their questions. They're free to ask and share, and we can schedule them so that we have time. We will make time to spend like to answer them, and our team will coordinate in replying to them.
Yeah. Okay. So here's one question. You said stroke management in hospital is a combination of multiple specialty. I think he means interdisciplinary multiple specialists. So which teams of specialists, doctors are required in stroke management?
Yeah. So what I said, it's not just opening the blood vessel. It is salvaging the brain. It's completely bringing the brain and bringing the person back to their normal life. So that can be done only with the help of a team. So the team, everyone have their roles and responsibilities. The team should, the rehabilitation team should have a speech language pathologist, a physiotherapist, a psychologist, an occupational therapist, and a social motivator or a social worker, and a neurologist, an interventional neurologist, and neurosurgeon, and a neurointensivist. So the whole team should work for a patient and the family. And the most important member is the family person. So we all try to be in the same page, and then we need to bring them back. It's not just bringing one person back to the life, it's bringing the whole family back to the normal track.
Okay, so here's one person. My dad is bedridden. He's a
Mhm.
bedridden patient. Actually, my dad suffers severe hyponatremia.
Hyponatremia.
Hyponatremia
Yeah.
and osmotic demyelination.
Yeah, osmotic
Ah,
demyelination.
so he
Yes.
wants to know what can be done for his father.
Yeah, one some like whenever brain is not able to give orders to the endocrine organs, or think excess sodium is lost from the body. So sodium is very important in our sodium is one of the element that is very important for every cells to function. So when excess sodium is lost in the urine or excess fluid is retained in the body, then the sodium will be low in the blood and functions will get affected. When they try to correct the sodium, they have to do it in a gradual way. Whenever like faster corrections or rapid corrections or rapid shift of sodiums can cause the nerves to like the nerves swell and then they destroy. So it is like another to the destroyed nerves, they won't function properly. So putting them in rehabilitation is very important. And someone who is bedridden, they need more care. The level of care is divided. So they need more personal and nursing care, and along with the rehabilitation. Still, like putting them back to completely normal. There's no like rehabilitation is the only thing that we do have currently to bring them back to normal life.
Thank you, sir. Here is one question. Will Moya disease cause stroke? What is the prognosis for this disease after surgery? And how long will the patients be on medication?
Okay, so what is Maya? Maya is it's like peripheral vessels, the smaller vessels. They will like they completely depend on the stem. That means there will be two blood vessels running on the front, two blood vessels running on the back, and then the large vessels will divide again like a tree, and then it spreads out. Suppose if the main trunk is at trouble, then the peripheral vessels or they don't get enough of blood supply.
Okay.
That is called moya moya. So like the main vessels, like the main branches, they shrink. And when the main way gets blocked, then naturally the other channels will open up and try to compensate it. Sometimes it may not be able to compensate. Suppose if the mount road is blocked, then the traffic has to diverge through the thing. Sometimes it cannot happen. So then we need to help them. So like how in heart, if there is a block, we bypass it. We create an artificial bypass. The same way the surgeons will do a bypass. They take one of the blood vessel running on the surface of the like skull and connect into the main stem. So now we are creating a new road, like our outer ring road or our right. So they will bypass, and they will have to be on follow up to check whether the bypass is properly working or not. So that
Okay.
is more important.
Okay. So here's one question. My relative is 60 years old and she has had stroke. She has recovered. But one day she's active, the next day she's sleeping all day. What will be a solution to improve her lifestyle?
Okay. So drowsiness indicates something the brain functions are still not at. They need to undergo a cognitive stimulation, like cognitive therapy. So in therapy, it's like to improve the brain functions. There are multiple tasks. Medications, they do have just a 20% role in making them alert, but 80% comes from the rehabilitation that they give. So a cognitive therapies is what they have to focus on. So some interacting with them, and the cognitive specialist will have multiple programs with them to make them interact, to make those cells to stimulate and function properly.
Thank you. So after brain tumor surgery, why does a patient become paralyzed?
Brain surgeries. When they try to remove the tumor would have destroyed. Sometimes there are many causes for it. The tumor would have destroyed some of the brain cells by pressure effects. Sometimes a tumor can bleed. So there will be multiple mechanisms for the brain injury to happen in case of brain tumors. So some sort of weakness which can recover immediately. Some will take some time after the brain surgery to recover. So when we handle the tumor or the tumor itself, it will cause some damage to the brain cells.
Okay, so my dad suffers from severe hypo. Oh my God, this is too big a word for me. Anyway, so I think it's the same like the early one,
Hyponatremia,
hypoinemetry, yeah, and osmotic
demyelination.
demyelination.
Yeah.
So the doctor said 50% of the kind of patients can't recover.
Mm-hmm.
But my dad is on the recovery path, and up to 70% apparently he's recovered.
Mm-hmm.
And he has started homeopathy.
Okay.
So he says, what is your opinion about this for this patient?
Okay.
So can
Yes.
he recover 100%? So
Okay.
he wants to.
Yeah, it depends upon the extent of the severity of the injury, as we discussed before.
Yeah.
So if the severity is more, then equally you should focus on the rehabilitation. And
Right.
as like you must be like you must by now you must be able to differentiate how he was before and how he's getting better. So rehabilitation makes them better every day by 1% and 5%. Like they should continue it. They don't have a destination, but we have to continue rehabilitation. If the severity is severe, they may not get the complete recovery, but rehabilitation is the only way for them to get back as close as a normal person.
Thank you. So what is trichostomy? Trichostomy?
Tracheostomy.
Oh, tracheostomy. Okay.
Tracheostomy, yeah.
Right. Why is tracheostomy done, and how long will it be for in the patient?
Mm-hmm.
Oh, okay. I get it.
Yeah,
What is tracheostomy?
yeah.
Right.
Tracheostomy is an emergency and a life-saving procedure.
Right.
So when we talk about safe swallow and to prevent aspiration, it's a way to protect our airway. So if we produce more saliva, like per day, 1.5 liters of saliva is secreted from the mouth. Very vital. And then without our conscious, we are swallowing it for the digestion purposes. When a person cannot swallow it safely, even their own saliva, it gets aspirated into the lung. It means the saliva enters the windpipe and it gets into the lung. The tracheostomy is one which can prevent aspiration, and the secretions can come out. It reduces the work of breathing, and it is a safe way to transit a patient who had a very bad stroke, who had not enough conscious level to prevent even their saliva from entering into the lung. Tracheostomy is a life-saving procedure.
Okay.
So once they gain the capacity to initiate swallowing and to protect their airway, then they can safely remove it.
Thank you, doctor. So here's one person who wants to know the difference between stroke and hemiplegia, and what is this? Apparently, this person has hemiplegia and is wondering if there can be a recovery.
Okay, stroke is a broad umbrella term for thing, and hemiplegia is a one symptom of the stroke. Means half of the body gets paralyzes, including face, arms, and legs. It's called hemiplegia. So once hemiplegia happens, they focus on physiotherapy and occupational therapy. So and sometimes spasticity management, and sometimes they go for contractures. So it's a team approach, and an assessment can tell like whether they will how intense they need the treatment, and how far the expectations that we can keep.
Okay, I have just 3 more questions to you. I think after that we will wrap up.
Yeah.
Because questions keep coming. But then, so here is somebody who wants to know SDH. Can it be cured?
SDH is like subdural hemorrhage. It means brain is protected by a thick vault, our skull. So, and then beneath the skull, there are multiple layers to protect the brain again. So, God has kept the brain in the safest way. And between these layers, if there is a bleeding, then there is no space for the brain to accommodate. So, it is like if you have an injury on the hand, the surface, there's a swelling, so there's space, but inside the skull, there is no space. So the blood leaking under a dural membrane, protective membrane, is called subdural hemorrhage. This is a small blood hole. If the size is significant, like more than 1 centimeter thickness, the surgeons make a small coin-sized blood hole. They can evacuate it, and then the pressure on the brain comes down. So they will feel symptomatically better.
Okay, so this person says, I am 58 years old. He's a man. I had stroke 2 times in 2016, and the last one was in 2018 June. I became unconscious suddenly for 20 to 30 minutes each time.
Mhm.
And after each stroke, I completely became normal
Mhm.
after approximately 30 to 45 minutes.
Mhm.
I have no issues now.
Mhm.
I am on Eptoin 100
Okay.
and
Mhm.
Levipil 250.
Mhm.
Please guide me. What should be done now?
Okay. So after, I'm not sure like what he's really talking, like this is a stroke or a seizure, but the history is limited. Whether if it is a seizure, just a seizures, the brain throws high voltage currents, and then they have convulsions. Suddenly they lose their consciousness, and then the electric, like their circuits becomes normalized, and then they regain the consciousness. That's what happening in epilepsy. The high voltage generation of currents, and then it goes
Okay.
shutdowns, and then it reconnects. So all the Levipil and Eptoin is to balance the electric, uh, what is electric polarization that is happening in the brain in a normal way. And if there is a recurrence, they need to consult a neurologist or an epileptologist, titrate their medication so that they can monitor with the help of an EEG. If the EEG is good and if there's no seizures, he can continue the same medicines. But if it is troublesome and in spite of taking adequate medications, if he's getting it, he should consult and then step up the dose.
Okay. Thank you, sir. So here is my last question to you.
Mhm.
How much is a physiotherapy? How important is physiotherapy in after stroke?
After stroke,
Mentioned.
physiotherapy, yeah.
Yes, yes.
Yes, it is like even when we talk about all advanced techniques and softwares and things, there is nothing to replace two things. One is the clinical assessment and judgment, and another is rehabilitation. So after strokes, when all our technologies and weapons are exhausted, the only source or the only hope for them to get back to normal life is physiotherapy. No
Yes.
modern medicines can bring the lost cell, but a
I know,
physiotherapy.
I agree with you.
Yeah,
Better to prevent that. You've been mentioning that right from
yes,
the beginning. You've been insisting that it is better to
prevent
prevent
it,
stroke
prevent it, stroke.
and not become a victim of stroke and then try to come back to life.
Yes,
Thank you, doctor. Thank you very much. It
thank you,
was
ma'am.
very
Thank you.
interesting, and we had plenty of questions. If there are some that have been left out and they are personal, they will be
Definitely,
sent.
we will get back to them and we will answer their questions.
Yeah. Thank you very much, sir.
Thank you, ma'am.